you can help us.
Yes.
Please tell us how.
You know what? Before I go into how, because I have to calm down right now. I feel my blood pressure going up just now.
Just listen and die.
Yes, because it's like, good Lord, help the people. But you know what? Before I talk about how I can help, I have a question for you, Dion, Melissa, and the rest of the people. And I know, thank God, everybody listening on the radio, they take better care of their health as Bahamians. I know the people out there do. But anyhow, the question is, what is the value of your health to you? I'm listening. You're looking at you. What is the value of your health to you? And when you weigh in the balance, good health versus poor health, how do you work out that equation? When we dissect good health, here's what the equation looks like. With good health, our minds and our emotions are free of concern about our bodies. Ask someone who has cancer or someone who has a disease that they're dealing with, what is that mental and that emotional journey like? Ask them about the torture about that. With good health, when we've got good health, we just function better. When everything is working, well, you're free to focus on everything else. You see you two laughing and talking here? You know why you're laughing and talking? Because you got good health. You let something go wrong. And my experience with that is when I had my accident. February 4th gone, made 4 years since I nearly lost my life. And I remember what had happened was the airbag had exploded into my chest. And it fractured my sternum bone, which is the hardest bone to break, that was protecting my heart and my lungs. Both were injured, including 3 ribs on one side and 1 on the other. And I remember at one point, I didn't realize what had happened to me. My body started acting crazy, and my heart felt as though it was coming out of my body. And my body at one point just naturally, I didn't realize my heart or lungs were affected. So I started my body was just naturally just gasping for air. I just started gasping. And one of the gentlemen realized what was happening. And he, instead of they had me laying down, they had propped up my top part of my body against his leg. The fear, that territory, I promise you, you don't want to go into. When your body is normal, you're unconscious. But when it comes, when the body's acting crazy and out of control, that is a crazy place to be. Again, the question that I'm asking is, what is the value of your health to you? See, when we have good health and our bodies are functioning, we enjoy life more, don't we? We enjoy life. I had a cousin. She has passed now. She was a physician and she died of stomach cancer. And I remember one of the last things, my conversation with her, she was ready to die at that point. And she said to me, this is no quality of life to live. It was horrid what she went through dealing with the cancer. Again, when we have good health, we are happier. You see us sitting here talking, laughing. You know why you can talk and laugh? Because you are enjoying good health. Ask anybody who is dealing with poor, deteriorating health. Are you happy? What is the value of your health to you? See, when you invest in your health, your returns are multiplied and you benefit greatly. Even the persons who would be caretakers for you eventually would benefit, because even them, their lives would benefit. When I come on the air and I am encouraging our population to take the Chagangano or to enroll in our 21-day Healthy Habit Challenge, it is about deciding on living an acceptable level of health, good health. And again, I'm not hitting, you're talking about eating your stew fish and your potato bread, nothing wrong with that. And then put some Long Island grits with that and you good to go. But My question today to everybody listening: what is the value of your health to you? How and what are you willing to do to invest in your health? And I want to encourage everybody listening that the chaga and the gano, the Japanese call the chaga God's gift. If you want to take care of your health, if you want to stop compromising your health, because we compromise it too much, I want to encourage you, take the chaga and gano. The testimonies that I've been getting are so encouraging. And even if you're not on that journey yet to taking care of your body like you should, like Brother Dion is, because Brother Dion is, I'm sure he's still drinking his water in the morning, a lot of water, and he doesn't eat red meat. You hear him talking, he's still doing his part. He's not there all the way, but he's nearly there. But the thing is, I want to encourage everybody, take the chaga and the gana. You hear it, you hear me talk about it, you hear the testimonies. Invest in your health. Do not wait for crisis. Those of you dealing with high blood pressure, cholesterol, sugar, it will help you. Those of you dealing with circulation issues, the chaga and gana will help. Those of you, and I got good news. I've got my third person who, with seizure issues, the chaga and gano has been helping. I have a lady who's been, her nephew, he's in his 20s, he was having a lot of seizures every week. After taking the first month, she called me, she said, nothing is still happening. I said, don't give up. Keep going. She called me back and she said, listen, because she got the second set. She said last week, it was the week before, she said to me, he did not have any seizures. And last week, also no seizures. I have to call her this week just to get an update. But again, this is the kind of testimonies. And again, we don't have everybody, it happens right away, but we do get results. We get people who were constipated, say they're cleared up. We get people who don't have any energy. And again, I talked about persons, because I have had a number of persons with this tingling in their hands and in their feet, nerve issues, telling me that it's gone now, taking chaga and gano. So I want to encourage those of you listening, value your health enough to invest in it. The costs you pay for the chaga and gano is pence compared to what you pay in the long run when disease happens, when sickness happens, when you have to go and pay a lot of money to try and undo what has been done.
Indeed. Of course, Patrice,